Introduction: British scientists observed for 12 years men over 50 and discovered, here's the thing. Those who had sex, though twice a week, they would die from heart attacks are twice as rare. They did not take some special pills, didn't run around in the morning, just twice a week. And now I'm going to tell you something that will make you feel uneasy. Most people after 50, they themselves refuse this defense mechanism voluntarily, considering that age is no longer the same. Today I'll explain what exactly is happening to yours heart, brain, and blood vessels, and why is this more important than you think. Here's what the heart is: a smart load most people don't know. Sex is not a marathon. An average episode. Sexual intercourse raises the pulse to 120 to 130 beats per minute at peak and keeps it there 3 to 5 minutes. Cardiologists have known about this for a long time. Measured. It's about the same as climb 2 flights of stairs at a quick pace, no more. And some patients, they do it in the morning, and no one bothers them, says, "Be careful, heart." Well, that's it. Interesting. A regular cardio workout loads the heart evenly and sex in waves. The excitement builds, then subsides, then rises again. And these waves are not chaos. They train what cardiologists call it variability heart rate. This is the ability of the heart change pace quickly in response to stress. The higher the variability, the healthier heart. The lower, the higher the risk of arrhythmia and sudden death, literally. A 1976 American study, the first major one, showed in men, died during intimacy. In 90% of cases, it was an extramarital affair. Unfamiliar environment, alcohol, stress, age, partners 3 times younger. That is, they died not from sex, they died from anxiety, guilt, and loads that they themselves created. A beloved, familiar person at all different physiology. Blood pressure rises, moderately. Cortisol is not off the charts. The heart works exactly as it should. Work at light aerobic intensity. 30 years, I repeat this to patients. Victor Semenovich, by the way, arrived 3 months later for a follow-up appointment and smiled, so I understood everything without words. But now I want vessels and nitric oxide tell you about things that are more important: pulse and pressure. During intimacy, in a molecular process, is launched in the body, a process that directly determines, will you live to have a heart attack? There is such a substance, nitric oxide, don't confuse it with nitrous oxide. These are different things. Oxide nitrogen is produced by the inner wall, your vessels, the endothelium. And he causes blood vessels to dilate, relaxes the muscle layer, reduces pressure, prevents blood clots from sticking to wall. This is your inner anti-atherosclerotic protection. It is not in pills, it's in you. So, sexual arousal is one of the most powerful stimulators of oxide-release nitrogen, and not only in the organs of the small pelvis, throughout the vascular bed. When this happens regularly, endothelium literally trains, he becomes more responsive, more elastic, blood vessels age more slowly, and now, about which usually makes my patients freeze. A man's erection is not just the physiology of desire as a test for arterial condition. Penile vessels 4 to 5 times larger than coronary ones, those that feed the heart. And when they start to work poorly, this is the first signal. 3 to 5 years before the same problems will appear in the heart, urologist who sees erectile dysfunction men 55 years old must immediately refer him to a cardiologist. Not because it's not age, but because the vessels are already talk about themselves. Women have a mirror image history. Decreased hydration, sensitivity, interest after 50 is also a vascular signal. Estrogen protected the endothelium, it became less, and the vessels reacted first. I had a patient, Galina Andreevna, 58 years old, came with blood pressure 160 to 90, not gets confused. I asked, "How long ago has your intimate life changed?" She blushed and said, "It had been almost 3 years, no way. We didn't start with pills pressure, we started with the vessels. Through for 6 months, the pressure was 130x to 80 without hypotensive. Regular sexual intercourse activity after 50 reduces risk cardiovascular events not on percent, tens of percent. It's not me. I came up with it. It's an American magazine. Cardiology. This is Harvard School. Healthcare. And here's what cardiologists are talking about: brain and dementia. They hardly speak. What's happening with brain, especially in the first 40 minutes after orgasm, changes the whole idea of dementia and aging. In 2016, neurobiologists from the University of Mogila, what they did was put people in an MRI machine and asked to achieve orgasm right in the tomograph because they wanted to see what happens to the brain in real time, and saw. At the moment, orgasm is activated immediately by more than 30 areas of the brain. At the same time, prefrontal cortex, hypothalamus, brain, limbic system. This is not "it's just a nice feeling." It's the most large-scale synchronous activation that the brain is generally capable of producing. Nothing other. No music, no food, no conversation doesn't provide such coverage. What does this mean? For you after 50? Here's what. Brain works on the principle: use it or lose. Neural connections that are activated degrade. This is called synaptic thinning. This is what underlies dementia. Not the plaques themselves and the loss of connection between neurons. And regular sexual activity literally counteracts this process. She makes those parts of the brain work, which in ordinary life a person has after 50 are idle. Research Oxford University 2012 showed that people are older 50, leading an active, intimate life, perform better on tests working memory and processing speed information. The difference is not symbolic. And on average 23% better than their peers without such activity. Now about those the most 40 minutes. After orgasm, the brain receives a wave of oxytocin and prolactin. Oxytocin reduces cortisol levels, stress hormone in the blood sharply, and cortisol, if it is chronically elevated, literally destroys the hippocampus, the area brain, responsible for long-term memory. This has been proven. Chronic stress without discharge, its slow atrophy memory. Orgasm is one of the most physiological ways to lose this accumulated cortisol. And the effect lasts exactly about 40 minutes. Then hormonal levels return to normal original. I had a patient named Mikhail Petrovich, 64 years old, complained of memory problems, forgets words, loses his train of thought in the middle phrases. Passed the examination. Organics no. I asked about sleep, about stress, about personal life. It turned out that 3 years in a state of Cold War with his wife. There is no physical intimacy. Cortisol is he was like an airport dispatcher in rush hour. We worked together. In 4 months he said, Roman Igorovich, I started reading books again. I couldn't before, my thoughts were running wild. You know, I've been talking for years about this to patients at the reception, one by one, 2 people a day. He came here to reach those who need a doctor. I haven't gotten there yet. If it's important to you, subscribe. I come out every week. Hormones, testosterone, and estrogen now about hormones. After 50 hormonal levels change in everyone, and men and women. But few people know what is sexual activity in itself is able to correct this background without injections and pills. A typical story, which I hear once a week. Man comes with complaints. Fatigue, stomach growing, mood is at 0, desire it's gone. He takes tests, testosterone lowered, the doctor says. That's why I lost my desire, my testosterone is low. And prescribes replacement therapy. Logic it is clear, but it is not complete, because testosterone didn't decrease on its own. Decreased, including because activity has stopped. It's a loop. Feedback, and it can be broken with both ends. This is what they show research. In men who have sex regularly, basic testosterone levels drop by an average of 15 to 20% higher than peers without such activity. Not because they initially healthier, but because the system is working. The testicles receive a signal. They need a hormone and they produce it. It's like the muscle stopped loading, atrophied, started again, is being restored. Now about women. After 50, the ovaries sharply decrease estrogen production. This is menopause. This is physiology. You can't argue with that. But here's the thing. What's important is that the adrenal glands continue to produce a small amount, estrogen and testosterone. Yes, in women there is also testosterone, and it is responsible for libido. And regular sexual activity stimulates this adrenal production, plus enhances local blood circulation in tissues, which in itself supports sensitivity and hydration. This is not mysticism, it's physiology. I had it. Patient Nina Vasilyevna, 56 years old, came with a classic painting menopause. Hot flashes, dryness, irritability, 0 libido. Husband, he says he's not even trying anymore, I asked. Are you trying yourself? She was surprised. Question explained. Wait until he returns. The desire to start is a trap. Desire doesn't come back on its own. It needs to be run like an old engine for a few twist at once until it grabs. After 3 months, she came back different, a person without hormone therapy. There is another hormone that is almost unknown, they say in this context. Dehydroepiandrosterone DHA. It's called the hormone of youth. It decreases after 40 years by about 2% per year. And regular sexual activity slows down this decline. Not stops, but slows down. The difference between those who lead an active life at 60 and for those who gave it up at 50, this is years of biological age, not subjective sensation, real. Pain, joints, and inflammation. Now about what is especially important for those who have joint or back pain. Sex works as an anti-inflammatory, literally through a very specific biochemical mechanism. Chronic inflammation. You may have heard this term, but most people don't understand what it really is. It's not when something hurts and is swollen. It's a quiet, unnoticeable process. Constant low level of inflammation markers in the blood. Interleukin factor, tumor necrosis, C-reactive protein. When they are chronically elevated, slowly joints, blood vessels, and nerves are destroyed tissue. It is chronic inflammation. Underlies arthritis, atherosclerosis, Alzheimer's disease. This is the common root. Orgasm causes a powerful release of endorphins and oxytocin. And both of these substances suppress the production of inflammatory cytokines. Non-symbolic, measurable. A 2004 study found that people with regular sexual life level interleukin-6 in the blood is lower on average by 28% compared to those who live without proximity. 28%, this is not an error, it is clinical significant difference. Now about the pain. Endorphins that are released during time and after intimacy is yours internal morphine-like system. They bind to the same receptors as painkillers. And they work. People with migraines in several studies, orgasm relieved the attack completely or partially, in 60% of cases. 60%. This is more than some drugs. Alexander Nikolaevich, 58, came to see me. Years chronic lower back pain, 2 herniated disc. He says, "What's that? Sex? I can barely walk." I explain, the spine is not a ban on intimacy. This is an opportunity to find positions in which the load on the lower back is minimal, because that abstaining from intimacy will increase inflammation, which will increase the pain, which will increase refusal. A vicious circle. After 2 months, he said, "Roman Igorovich, I have become smaller, take ibuprofen, but there is another one effect. After intimacy, cortisol drops sharply. This is critical for joints. It's important. This is why cortisol suppresses collagen synthesis, literally blocks his. Chronically high cortisol is slow destruction of cartilage tissue without any physical overload, just from stress. And every episode of intimacy, cortisol lowering is a small protecting your cartilage. Not a metaphor, biochemistry. I understand that all this sounds, it's unbelievable. But I've been looking at it for 20 years, tests, images, medical histories, and I see the difference between those who retain this part of life and those who are from it refused. The difference is visible not only in mood, it is visible in the blood. And now immunity about immunity. There are specific research, specific figures that I want to tell you. Wilkes University, Pennsylvania, 2002. Researchers divided the students into 3 groups. The first one is without sex. The second one is alone, once a week. Third, 3 times a week and more often. Then they measured everyone's levels. Immunoglobulin A, this is an antibody, which is the first to encounter viruses and bacteria on the mucous membranes of the nose, throat, intestines. Your first line of defense. The second group, those who once a week, the level of immunoglobulin A was 30% higher than the first one. 30%. But here's the thing, interesting. The third group, those who 3 times or more often, the indicators were lower than the second one, almost like abstaining. Because too high frequency creates physical stress, and this stress suppresses the immune system answer. This is important to remember. There is nothing the more the better. Optimum, twice a week. It is at this frequency the immune system receives a stimulus without overload. Why does sex affect immunity? Through several mechanisms. The first is a decrease in cortisol. Cortisol, immunosuppressant. It literally turns off part of the immune response. Evolutionarily, this is justified. At the moment of danger to the body, I don't have time to fight viruses. I need to run or fight. But when cortisol is chronic wormwood, immunity is chronically suppressed. Every episode of intimacy resetting cortisols is an immune system unlocker. Systems. The second mechanism is emission dehydroepiandrosterone, that same DGA. It not only slows down hormonal aging, it directly stimulates the activity of natural killers, cells that destroy viruses and tumor cells after 50 DGA falls, and all that is his supports, works for your oncological protection. I had that too. Patient Tamar Ivanovna, 60 years old, every autumn, sometimes twice a year, season. Immunogram at the lower limit norms. We got to talking, it turned out she was a widow 5 years. There is no intimacy. Lives alone, communicates little. I explained the connection to her. I said, so what should I do now? Said, first of all, don't isolate yourself. Physical contact in general, hugging, tactile communication also provides immune. The answer is weaker, but it works. And then we'll see. A year later, she signed up for dancing, then I met. That winter, not I've never been sick. This isn't a story about what lonely people urgently need to find partner. This is a story about the body. You can't fool me. Isolation is stress. Stress is cortisol. Cortisol is suppressed immunity. The connection is direct. Now about pressure and sleep. And this is for many, sleep and blood pressure. My patients consider it the most practical, most important of all. Scottish scientists, University of Stirling, 2006 experiment. 3 groups of people with mild hypertension. The first one had sex, the second is masturbation, the third is nothing sexual contact. After 2 weeks measured the stress response. People were imprisoned, solve complex problems under pressure time. The first group has systolic pressure in response to stress rose in on average by 9 units, the third by 24, almost 3 times stronger. This is not resting pressure, this is stress, vascular reactivity. How much your blood pressure suddenly jumps in response to any irritant, traffic jam, conflict, disturbing news. And precisely this reactivity is killing. It's not basic. Pressure and peaks. The mechanism is simple. Regular orgasm reduces tone, sympathetic nervous system, the one that is responsible for the fight or flight response, and enhances parasympathetic tone, regime rest and recover. Vessels in this mode, the pressure is more relaxed, more stable, the peaks are weaker. Came to I am Lyudmila Fedorovna, 63 years old, stage 2 hypertension, took 2 drug. My blood pressure stayed at 150. I collected an asked about sleep. It turned out that he had difficulty falling asleep, wakes up at 3 a.m., lies down until 5 a.m. A classic picture. An intimate life. It's been 4 years. I explained the connection. She asked skeptically, what is this? Instead of pills. I said, no. It's with pills to make them smaller. Now about sleep. After orgasm, the brain receives a wave of prolactin. This is the same hormone that is produced during deep sleep phase. He literally switches the brain into braking mode. Plus a sharp drop in cortisol, plus oxytocin, which many people have causes a feeling of warmth and heaviness in body. All three factors at once are the best natural sleeping pill, that there are no side effects, no addiction. 2019 study survey, more than 1,000 adults showed 62% people reported falling asleep faster after sex. Average time to fall asleep in 2 times less than on normal nights. And it's not just convenience. Deep catfish. This is when the brain is cleared of beta amyloid, the same protein that accumulates in Alzheimer's disease. Bad catfish is literally an accumulation garbage in the brain night after night. Lyudmila Fedorovna came to the hospital after 3 months. Reception. Blood pressure 140, 1 medication removed. He says, Roman Igorevich, I am sleeping normally. For the first time in when sex is dangerous many years. Now the part that many people wait anxiously for sex really dangerous. Real contraindications. Myths about heart attack in bed and what the real one says statistics. Heart attack risk directly during sex, 1K a million per episode. 1 to a million. For comparison, the risk of heart attack during morning jog for an untrained person, a person is 8 times higher. The risk for driving during rush hour is comparable to sex, statistically one of the safest types of physical activity. This is not my thing. Opinion? This is American Data Cardiology Association now, a figure that will be alarming. Among those rare cases when a heart attack does occur happens during intimacy, 75% occurs outside of marriage. Unfamiliar, the situation is anxiety, alcohol, vascular stroke, big difference in age, emotional stress. Fear of exposure is chronic cortisol. It's not morality, it's physiology, stress. The body pays for what the head hides. Now the real ones, contraindications. There are fewer of them than people think. Most people. First, unstable stenocardia. If you have chest pain at rest or under minimal load, first stabilization, then everything. The rest. The second is a severe heart condition. Insufficiency. Third, fourth and functional class when a person gets out of breath when walking around the room. Obviously. Third, the acute period of any cardiovascular event. Infarction, stroke, heart surgery, quarantine from stress and sex are no exception. Usually it's 4-6 weeks. That's what's in it, there is no list. Stable hypertension under, there is no control, no history of heart attack. More than 2 months ago, under normal conditions, there is no load tolerance, no stenting, no atrial fibrillation. Without decompensation? No. Varicose veins? No. Osteochondrosis? No. Age? No. Was there my patient is Gennady Mikhailovich, 67 years old, underwent coronary stenting arteries. After 3 months, I came for an appointment. My wife is sitting next to me and she says, Doctor, we are afraid. I asked him to go along the corridor with a quick step back and forth, 50 meters returned without shortness of breath, pulse 85. I say, Jenna Mikhailovich, your heart just coped with the load, which exceeds what you need in bed. What exactly is stopping you? A pause. Then he smiled. There's another one. A moment that is little talked about. Some drugs affect sexual function, and this creates vicious circle. Beta blockers of the old generations reduce libido and cause erectile dysfunction in every third-person men. Thiazide diuretics are similar. Some antidepressants of the C3S group delay or block orgasm in both floors. If you are taking any of this is what you notice the changes, don't tolerate it silently. There are almost always analogs. A conversation with a doctor takes 5 minutes. Silence can cost several years' quality of life. And now perhaps the most psychology and longevity, the most unexpected thing I'll say today. Psychology and duration life. Duke University, USA. Scientists observed a group of people over the course of 25 years since 1958 until 1983. They recorded everything. Blood pressure, cholesterol, weight, smoking, physical activity, and including cleanliness and pleasure from intimate life. When after 25 years we looked at mortality, it turned out that men who reported high sexual satisfaction in beginning of observation, duration life expectancy was on average 8 years longer. Years, not months, years at comparable health indicators for all other parameters. 8 years is more than it gives smoking cessation in humans, smoked half a pack a day, more. What are the benefits of switching to the Mediterranean diet? One indicator, sexual satisfaction, turned out to be more powerful most of the factors that we traditionally consider them key. Why? Because sexual satisfaction, this is an integral marker. She does not exist separately from everything else. A person who is good in this area usually has close relationships. Close relationships reduce chronic stress. Low stress is healthy. Cortisol. Healthy cortisol is preserved immunity, strong blood vessels, whole hippocampus. This is not the only reason. This is a whole cascade. And sexy contentment is at the beginning of this cascade. There is such a concept in gerontology, subjective age. On how old does a person feel? And this not just how I feel. Subjective age predicts mortality regardless of biological age. A man who feels like 10 years younger than his passport age lives on average longer. And one of the main factors, Determining the subjective age after 10 turned out to be exactly sexy activity. Neither money, nor pension, nor number of grandchildren. Feeling of oneself desired and desiring. This is literally biological anchor of youth. Came Valentina Grigorievna, 61 years old, came to me. I came to formally check my blood pressure. At the end of the conversation, already standing up, he says quietly, "Roman Egorovich, last year I met a man. I'm ashamed about talk about this. The children are adults, grandchildren, but I feel like I'm 40. I replied, "One. Valen Grigorievna, this is not a shame. It's immunity, hormones, and another 10 years. Life, congratulations." There is another one in effect that I want to name separately. Touch. Tactile contact between close people, hugs. Stroking triggers the release of oxytocin, regardless whether it ends in sex. And this oxytocin reduces the perception of pain, normalizes blood pressure, strengthens immunity. In people living in a couple with regular tactile contact, level inflammatory markers are consistently lower than for lonely people. Loneliness is not sadness, it's literally inflammation. And now what to do right now, specifically, what to do right now depending on your situation. Situation first. There is a desire, there is a partner, but intimacy has become rare. This is the most common case in my practice. People don't. We quarreled, we didn't fall out of love. It's just life sucked in, tired TV, different graphics. Do you know what it's called in couple psychology? Drive. Not a breakup. Drive. The boat isn't sinking, it's just slow. It's moving away from the shore. What should I do? First, agree out loud. Most couples never talk about this directly. They are silent and wait until the other will want it first. Both are waiting, no one starts. A 5-minute conversation decides a problem that silence does not solve years. Secondly, to remove fatigue as reason, not as a slip of the tongue. Chronically, a tired person doesn't want anything. This is physiology, not psychology. Sleep, routine, lowering cortisol is not preparation for intimacy as a condition for any normal life. Thirdly, don't wait wishes. Remember the old motor? The desire after the bird comes more and more often before, but during. This is normal. Physiology has changed. This is not a breakdown. Situation 2. Something stopped work physically. Men have an erection. Unstable or weakened. In women, dryness, discomfort, decreased sensitivity. The first thing to do is see a doctor. Don't be patient. Don't look for answers on the internet. Don't buy what you need from the pharmacy a neighbor advised. Erectile dysfunction is a vascular symptom. It requires examination of the heart and blood vessels, and not only urology. Dryness in women in menopause is perfectly resolved by local estriol preparations. This is not systemic hormonal therapy, is a local application with minimal absorption, safe for most. Effect in 2 to 3 weeks. This is not a shameful topic. This mucous membrane that needs help. How the skin needs cream. Secondly, check drugs. Beta blockers, diuretics, antidepressants. If you started taking some of this and noticed changes, talk to your doctor. Don't cancel. On your own. Conversation. Situation third. No partner. Loneliness after loss or divorce. The first is not isolate yourself physically. Hugs with close ones. Tactile contact. Massage. It's not a replacement, but it works. Support for the immune system and nervous system. Second. Don't close this part of your life off. The chapter that ended. Tamara Ivanovna went to the dance not for sex, but for life. The rest came by itself. Third. If you have a desire but no partner, masturbation. I say this calmly like doctor. Physiological effect, reduction cortisol, endorphin release. Support hormonal background is present. This is not perfect, but it's better than full system lock. And last but not least, for everyone immediately. Stop counting this secondary. This is the main mistake which I see in people after 50. They prioritize. Pressure, it's important. Cholesterol is important, joints are important. And that's something later. It's awkward, not serious. But today you learned this affects the heart, blood vessels, brain, immunity, inflammation, sleep, pressure, and life expectancy. This is not entertainment, is physiology, and it is not ends at 50. It ends when you decide that it's over. I'm Roman Igorovich Tlyashev, 20 years in medicine, and I am convinced that the quality life after 50 is not determined just by what you eat and how much walk. It is determined by the fact that how fully do you live in all meanings of this word. Take care of yourself.